Welcome back. We're in studio with Dr. Kim talking about perioplastic surgery and dental implants. All right, Dr. Kim, before we went to break, we were talking about perioplastic surgery and what you can do with the gums, and it's just amazing. Implants, though, what is an implant? I mean, I hear about them. What are they actually?
Actually, I can show you this one of the form of the implant. Actually,
Okay.
these are the current form we're using implant. But implant has been there since 5,000 years ago. I mean,
Okay.
Egyptians used the implant. I mean, the different format and different materials.
But it's very new to this country.
Right, very new to this country. But current form of the implant, as you can see, is a kind of screw form, and invented by Dr. Brennemark, who is the inventor of this kind of implant since 1965.
In Sweden.
In Sweden.
Now,
And
you
then-
went there to learn.
Yes, I went there to learn where they came from and how they do it.
How many dentists do you think have actually done that?
I don't know. There are many
Very
dentists,
few.
probably, yes.
Okay.
So-
So anyway, that goes right in the jaw.
Right into the bone. Actually, this is a gum, but imagine that under the gum you have the bone. You have bones,
Okay.
and you place the implant into the bone.
All right.
And after the surgery, these days, I mean, you can place the crown right away, but we don't want to go there. So traditionally, you wait about 4 to 6 months on the lower jaw, about 5 to 6 months on the upper jaw.
But you can aesthetically in the front place one on right away,
Right.
so that they have a tooth that people
Right,
can see.
yes.
Okay.
And then after that, you do the secondary surgery and you uncover we call it uncover, and to them around the oral space, and then we place this crown on top of it.
Okay. Now, I know you brought some pictures. We're going to take a look at them. I interviewed dentists all over the place, not a lot of periodontists, but general dentists that put in implants. They always talk about the implants they put in on the lower jaw. The first one we're going to look at of yours is in the upper.
Right.
Very few people do implants in the upper that I can tell. Why is it that everybody's not afraid to do the lower, but the upper seems to be a bit more of a challenge?
Yeah, lower jaw tends to be the strongest bone around our body.
Okay.
Actually, strongest bone. So it means that after tooth extracted, I mean, you still keep the bone structure in there. So usually you have plenty of bones to place the implant.
So is
But
it just more tough on the
Yeah.
top? Is it harder?
for the upper, actually, upper is the weakest bone in our body. Actually, it's more like spongy bone.
Right.
We call it. And so as soon as you lose tooth in there, actually, what happens is that you lose all the bones.
Right
and
away.
Right away.
All right.
So
Let's take a look at the first picture. Now, this is an upper, missing a single tooth, right?
Yes.
Tell me what you did.
So what I did was I placed the implant,
Okay.
and this patient also referred by the prosthodontist, and I placed the implant, and case went back to prosthodontist. Prosthodontist, as you can see afterwards, restore in full function with the
And that
aesthetics.
tooth will work,
Right.
no problem.
No problem. And
Doesn't
as
have
you
to
can
replace it,
Right.
unlike a bridge. Now, traditionally, they would have ground down the two
Tooth right next to each other.
and then put a bridge on.
Put the bridge on.
What's the life expectancy of an implant?
As long as you maintain him, first implant patient from 1965 still survives. So it means that 40 years.
Has had that implant for 40 years. And the
Right.
average bridge, 5 years?
About 10 years, about 75% of them are surviving.
And possible you could crack the tooth next
Crack
to
the
it
tooth
because you
next to
ground
each
it down?
other. Most of the time, next tooth involved to each other, so you expand the expansion later
Somebody
on.
said putting a bridge in takes a one-tooth problem and makes it a three-tooth problem. Is
Right,
that true?
that's true.
And then if that one cracks, then you got to go grind the next one?
Right.
All right, let's go to the next one. This person has missing, obviously, a lot of teeth on the lower right hand. And
3
then,
teeth.
And so what do you do there? Do you have to put in 3 implants? Can you,
Yes.
Okay, and then what do you do?
Even I could have placed 2 implants based on the situation. If the patient is female or doesn't have anything on the upper, is not strong enough, the chewing forces are not enough, you could have placed only 2 implants, build a bridge on top of it. But if the patient tends to be male and strong jaws, and you want to place more implant in there.
That's better?
Better.
And so this is done. Now, just real quick, because we got to take another quick break. What I see in the center of these teeth you've placed, and I see you placed one on the left rear also. Do you cover that with a tooth-colored composite so that
Right,
they
yes.
don't see that? So there's
Right.
no way you would ever know.
No,
And
they wouldn't be able
And
to
those
tell.
teeth are as strong as their natural teeth,
Probably stronger than their natural teeth.
and they don't have to worry about it.
Yes. This
All right,
is another
and
case.
we're going to look at one more case here just real quick, because this one actually shows 3 implants on the lower right. 2 of them are exposed, and the front one
It's covered.
It's
with
covered,
the
and
yes.
and there's no way you would know that wasn't
Right, yes.
wasn't a regular tooth. All right, Doc, we're going to have to take another quick break. When we come back, I want to talk a little bit more about how you use implants to secure dentures and some of the dangers of having the wrong person, an untrained or inexperienced dentist, place an implant for you. You're watching Medical News Network. We're in studio with Dr. Kim. We'll be right back.